Hey everyone, welcome. So, the main motto of today is to explain you guys about a new app called as My Health Record. It is an efficient healthcare that relies on reliable access and secure patient information. The health record system replaces traditional paperwork with the digital solutions. Sometimes at home, it is hard for us to find the right amount of paperwork for the required time. So, an app such as My Health Record System keeps track of all your previous data and helps us to find the required data at the correct time. It enhances communication among healthcare providers also. Also, it is helpful for patient safety through comprehensive data access. It is easy to get our data accessible by everyone when it is in a hard copy, but when it is through an app that keeps the data very secure, it is not, it is very hard for another person to access it other than yourself. So let's firstly get into the app. So when you gently tap, this is the home screen, and when you gently tap on the icon, you will be taken to an login page. A login page, if you're a user, you're supposed to enter the username and the password, and if you're not a user, you're supposed to sign up. Also, this is a multi login user, because this can be logged in by two people, that is the patient as well as the provider, which is the doctor or the admin. So if you're an admin, you log in through sign in as an admin, and if you're a user or a patient, you sign in through normal username and password, and you just forward it to save. So my name is David, the patient's name is David. So it's gonna welcome you by saying hello David, and it tells us about what all information about me that has been saved in the current app. So first we need to know about the patient information. So when you tap on the patient information, you will get the list of the information about the patient that is correct and that has to be known by anyone. So it tells us about the name, date of birth, the blood type, address, contact information, all the necessary details for a person to contact in emergency, or the patient information that is required to tell any news. So once the patient information is done, we can get back to the medical history. When you gently tap on the medical history, you will get two categories, that is, one is the category and one is the details. It tells us about all the allergies, the surgeries, the medical histories, all the past, the medical history that has to be known by any doctor who is accessing the patient's current records. So just by showing this medical history to any doctor, he would understand the type of problem the user or the patient is facing right now in his life. So this tells us about the allergies, the chronic diseases, the past surgeries, the medications, family histories, and the social histories and all. So when you go back, you'll get to know about the lab reports. When you gently tap on the lab reports, you'll get to know about all the information that has to be understood, that will be understood by the patient as well as the doctor about your health record. It tells us about your health. It tells us even if you scan this barcode, it will take you to the reports that are required, that are usually scanned, the CT scan or all the scans. It will take us through this barcode, and it tells us about the patient's name, the doctor's name, and as well as the age and the sex. So it tells us about the vitamin B12 and vitamin D, all the amount of levels that is present in the user, and it also gives us a note to the users. When once you have accessed your lab reports, you slightly take back, and once you have got your patient information, the medical records and the lab reports, you'll get to know the prescription that is official, and you can take it to any pharmacy in order to get your medicines. So tells us about the list of medications that you're supposed to take for the disease or the problem that you're facing it by the doctor. So it tells us about all, and it also gives us a little small bulletin board advices such as drink more water, or avoid the sun, or take more medication, like that. And it also tells us about the patient's name and the specialization of the doctor and the doctor's name. So once it's all done here, as I said, this is a two-way use. Once it is logged in by the user, and once it is logged in by the provider or an admin. So you're a patient, so your login has been done. So once you slightly go back, and you'll be directed back to the login page. So as you, if you're a patient, your work is done. But if you're an admin, a person who controls and writes the work, you will sign in as an admin. So when you sign in as admin, hey doc, here are your consults for today. So since the doctor is logging in, or the provider is logging in, he gets the details of all the users that he has to see that day. So when you gently press on David, you will get the patient monitoring dashboard, where it tells us about the patient's name, reference, and age. This is technically the card that has been created by the app for easy information for the doctor. Also, next, it tells us about the heart rate analysis. It tells us all about the patient's ID, the patient's heart rate, the blood cholesterol, the body temperature, and the blood glucose. By saying this, the doctor gets an idea about the patient's current normal levels of the blood. So when you gently tap on blood glucose, it gives us a chart about the blood pressure, the normal blood pressure of the patient. It tells us if the patient is suffering from BP, cholesterol, or whatever it is. It tells us in this. And medical adherence. Once the blood pressure is done, the doctor summarizes the medical adherence of the patient. And when you gently tap on the medical adherence, you'll be directed to the patient's overall chart of their health record. The first one is the step count progress. It is the progress of the patient in the last 1 week. According to that, the doctor analyzes the complete record. In this, the down chart is about the patient immunity. It tells us about his immunity and all the other things with the allergies, and how is he coping up with all the allergies and all. So once the doctor has reviewed all the pie chart, the graphs, the information that has been provided, he, as a provider, writes an overview. He writes a list or a paragraph about the things or the ways for the patient to access, for the patient to take care of the health. It tells us about what is wrong with the patient, what prescriptions he has to take, or when the regular checkup is going to be for him to access in order to talk to the doctor directly. So since the doctor is writing the overview, once he's written the overview, he's just gonna save it. Okay, he's gonna save it. And once his response has been saved, he'll be directed back. We'll get a symbols that such as the response has been saved. So once the doctor's work is done, he'll just go back, because the work he has come for is officially done, and he has given the report about the patient and all. So once he's done, he'll gently click go back, and the app will be done. So this is the entire project of my health record, and I hope you guys like it. Thank you.